Hello, everyone, and welcome to today's installment of the NIOSH Total Worker Health webinar series. Today, we're going to be talking about training supervisors to help reduce burnout among public health workers. My name is Emily Novicki. I'm a health scientist in the NIOSH Office of Communications and Research to Practice, and I'll be your host and moderator today. Today, in this installment of the NIOSH Total Worker Health webinar series, we're going to be talking about this online training, understanding and preventing burnout among public health workers, guidance for public health leaders. And first, I'd like to introduce our two guest speakers. They are the authors and facilitators of this online training. First, we have Dr. Chris Cunningham. He's a Gary Professor and UC Foundation Professor of Psychology at the University of Tennessee, Chattanooga, where he directs the top-ranked Master of Science degree program in Industrial, Organizational, and Occupational Health Psychology. He also does the Healthy and Optimal Work Research and Applications Lab. Chris also holds an adjunct clinical assistant professor position for research and evaluation at the University of Tennessee College of Medicine, Chattanooga, and is the chief science officer for LogiServe, a provider of science-based talent assessments and talent management technologies. Dr. Kristen Jennings Black is an associate professor in the psychology department of the University of Tennessee at Chattanooga. She received her PhD in industrial organizational psychology with a specialization in occupational health psychology from Clemson University. She has conducted research in occupational health for over 10 years with a focus on worker health, workplace stress, and supportive resources. She has specific interest in workplace climates and perceptions around stress and recovery. So Doctors Cunningham and Black co-authored The Essentials of Occupational Health Psychology, a text which provides an empirical overview and practical applications in the field. So thank you both for joining us today. Before we get into the heart of the presentation, just a quick refresher on what is total worker health. There are policies, programs, and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts to advance worker well-being. All right, so I'm going to start us off with an introduction about the training and why we decided to move forward on this. Burnout is maybe a term you're familiar with. It's a work-related syndrome. And that's really important to point out. This is the definition from the US Surgeon General. But the two things I really want to point out here is that it's an occupational syndrome. It's not a health condition that you can be diagnosed with, but it is an important thing that happens. And it's something that happens over a long period of time. So burnout is not just one bad day or a bad week. It's a cumulative effect where you end up with emotional exhaustion, cynicism, you're kind of detached from your work. So going into this, our two authors decided to interview some people in public health to find out from them, what is it like to work in a public health organization? What is the experience of burnout there? And these quotes are really telling. I think many of us will relate to these. This idea of fatigue, and more fatigue, when you've just had it up to here, when you can't, you just don't care about your work as much as you want to or as you used to, people in your office crying, this idea that just one more thing is going to be the last straw, like you're just going through the motions. This is what burnout is in practice. And burnout is a really serious and important issue in public health. So burnout is really prevalent. So 2/3 of public health workers experience this in a 2020 survey. While burnout itself is not a mental health condition, it is related to mental health conditions like anxiety and depression. And so we see more than half of health department workers in 2021 reporting at least one mental health symptom. And another concerning thing about burnout is that it leads to turnover. So people either leave their particular position or they might leave public health altogether because they've just had enough. And so in a survey a couple of years ago, about 40% of public health workers intend to leave their job in the next 5 years, which is very concerning as well. So as we were kind of coming out of the worst of the COVID-19 pandemic, we knew the workforce was really burnt out, but it doesn't have to be that way. And in fact, supervisors are a really important piece of the strategy to prevent and manage burnout. So supervisors are the people that know the day-to-day work best. They know people's personalities best. And so they are really in a great position to make a difference on this issue. We also, in our framing, really felt strongly that burnout is a workplace issue best addressed through workplace policies. There's definitely a time and a place for things like self-care that's certainly helpful, but ultimately to get at to really get at the root causes of burnout, to have a holistic solution, you also need to look at the workplace. And then finally, that we could teach supervisors strategies that they could, use to prioritize employee health and well-being and prevent burnout. So these are things that can be taught, and we can do that. So our audience for the training are supervisors and managers and state, local, tribal, and territorial or still health departments. But we've also found that public health staff at CDC have found it useful, people in leadership roles in public health serving organizations, and I've even noticed people from healthcare organizations have been registering for this training because it covers a lot of the fundamental principles of what causes burnout and what you can do about it that are very broadly applicable across settings. Um, and then for the format, we felt it was very important to make it online and modular. So there are 10 total modules. Each one is about 15 to 30 minutes. So supervisors who maybe have a lot going on, busy schedules, they can fit modules of the training when they're available instead of trying to carve out like a whole afternoon to take our 3.5-hour training. And we also offer free continuing education through the CDC Train platform. Um, if you've taken courses through CDC before and gotten continuing education, you might be used to the TCEU platform. It's now been integrated into CDC Train, so that's where you can find the course and earn free continuing education in multiple types. And with that, I'd like to turn it over to Drs. Cunningham and Dr. Black.
Thank you, Emily. I'm Dr. Kristen Black, and I can say on behalf of us both, we're really excited to get to talk about this project that we've had just a lot of fun putting together and trying to create some practical resources for a group that we hope can really benefit from it. And we just enjoyed in general getting to talk with a lot of public health workers and understand more about the important work that you do. So I'm going to walk through an overview of what's in this training and what you can expect if you were to take the full training, and just give a general idea on our perspective on burnout so that you can, if nothing else, leave with a better understanding of what this is and why you should care. So when we talk about burnout, this is a term that can be thrown around a lot, or I feel really burned out, but what we're talking about is that state that Emily described of exhaustion. And we really boil this down, and not just us, a wealth of research tells us that burnout can really happen when we have a chronic imbalance between demands and resources. And by demands, we mean anything that requires effort from us, problem solving, managing competing demands, or managing people. And resources are those things that help us to meet those demands, and those can come from your organization. It can even be your own energy and mood and meeting some of your basic needs for things like sleep and exercise and support from others. And when we think about demands, we know that we can't escape demands. We can't operate in the absence of stress in general. And if we tried to, most of us would probably get a little bit bored with that. So instead of trying to just get rid of demands or things that are stressful, what we need to talk about more is how we have adequate and fitting resources to help us meet demands. And that's how we can manage our demands without getting to a state of burnout. And so that's really the foundation that we use in order to build out our training and try to teach a little bit more about what burnout is and how we can work to address it.
Now, Emily alluded to this a little bit earlier, but many previous approaches to respond to burnout tended to emphasize real heavily a focus on self-care. And while that's very well-meaning and important as a component to the process, if we only emphasize self-care, we come dangerously close to blaming the victim, so to speak. So throughout this training, Kristen and I worked really hard to take a multi-level perspective on the phenomenon of burnout, as well as the recommendations that we offer to supervisors and those that are interested in trying to help prevent or address burnout as it's developing. So a guiding framework that we use throughout comes from Karina Nilsson and her colleagues' work, and it's been labeled the IGLOO framework, and you can see it represented here on this slide. And what that stands for is paying attention to individual level strategies, group level strategies, leadership strategies, organizational strategies, and also overarching context strategies and factors that might be pertinent. The reason this is so important is that these demands and resources that Kristen was just talking about, they exist, they originate at so many different levels of our reality, both in and outside of our work environments. And so if we're really going to get serious about burnout, what causes it, and also how can we address it, we need to be thinking more comprehensively about it. In terms of the structure to the training itself, we've broken up the content into 3 core portions, if you will. First batch focuses in on what burnout is, going deeper into what Kristen was discussing, as well as moving into a second portion that dives deeply into different types of demands and resources. And then the third element where we dive more directly into practical strategies for responding to these demand resource imbalances. Give you a little more concrete sense of what you could expect if you're able to dive into this training. There are 3 main units comprised of multiple lessons, and when you get into any one of those lessons or modules, you'll see a layout that looks like this. And what it begins with at the top, obviously, is your title, and then it shifts into a summary of learning objectives, which have been carefully designed for that particular module and highlighted there, so you have some idea of what you're going to be getting into if you decide to work through that particular module. Going a little bit further in these screens within the system, you'll see a recorded presentation video, which is presented by Kristen and myself, and walks through some materials, usually in slide format, with us kind of explaining what is on the screen in front of you. That content that you'll hear us present in those recorded sessions is also presented in an outline, which depending on the size of your screen, it'll be right down at the bottom there. And there's a hyperlink to a text outline of the core points and features of that particular module.
At the end of each module, there will also be a knowledge check, which is just a short quiz that has a few questions that really serve that purpose of seeing, did you get the main point? And so we created these aligned with those learning objectives that Chris talked about, just to see, not to make tricky questions, but just to know, did you get the main ideas or concepts that were important in that module? We also included some opportunities for you to take each module a little bit further. So that comes first through some discussion questions that you can either reflect on personally or bring them up maybe in a team meeting or a team retreat, something like that. And they might ask for examples in your specific workplace of what burnout looks like, what demands look like, ways to probe a little bit deeper into the culture or climate of your work group. And then we also included some recommended readings and resources for anyone who wants to learn more. Sometimes these are resources from the public health area, maybe some surveys or resources developed specifically in that context. And some are more broader resources on mental health, on burnout, that are from organizations like the CDC or the World Health Organization, and just some other resources that we think are particularly valuable. Getting into those 3 main units, the first unit is really an overview that helps you to understand what burnout is. And we contrast this with some things that are related, but not quite what we're talking about when we talk about burnout. So there's some other things like just being fatigued for a day or two. And there's some more mental health conditions like anxiety and depression that can be related, but they're distinct. So we try to define what we mean by burnout very clearly. And we talk about why this is important for public health workers. And like Emily said earlier, a lot of this was derived from just trying to understand public health more by digging in and having interviews with some public health workers, and also just broadly trying to understand the nature of the work. And so we talk about both why is it important for the worker themselves, because lots of public health workers work in situations where they are kind of at a higher risk for burnout, because you may operate with high demand and low resources. And we found that a lot of public health workers are really into the work they do. They feel a sense of calling, they're really engaged. And sometimes those people who love their work the most can be most likely or at a higher risk to get burned out in some ways. So we really talk through that, and also why your workers are going to be at their best when they're not burned out, and you can better serve your community when you try to keep those demands and resources in balance. And so a lot of those activities that go along with that module will help you talk about what burnout looks like and what are the implications of burnout in your particular workforce or your particular work team.
Yeah, the second unit of this series focuses in more deeply on this concept of demands and resources and how they fit together, need to fit together. And if there's an imbalance, it can lead to strain and other challenges, including burnout. And in these modules here, we dive into a couple of different types of demand resource profiles. So we'll look at situational elements, which would come from the actual work context, the nature of the work being done, the environment in which the work's being done, as well as the broader external environment, just like society and public opinion and things of that nature. And then the personal demands and resources are ones that are more closely aligned with individual differences in cognition, feeling, motivation, and those types of attributes, as well as internal experiences. And so this is where, you know, we have a chance to dig into psychological and social forms of demands and resources. Whereas in the situational area, we also get a chance to focus on demands and resources that might be more physical and environmental in their form or nature. In this set of modules, you'll see attempts to provide kind of concrete illustrations of what certain types of demands are, along with associated or pertinent resources, like you see in this snippet here from one of the training slides. And you'll see us also try to engage you as participants in activities that involve reflecting on demands that you're commonly facing and the resources that you need to meet those demands. And we do that in a very guided fashion, and also provide resources to help you have more of those kind of discussions within your own teams.
That third unit is where we try to be as practical as possible. So we get into specific strategies, and we frame these within that IGLE model, because strategies can target an individual worker, strategies can target an entire work group or leaders' behaviors or influence the organization as a whole, and even the community or the overarching context of the field of public health. And so we try to give examples of all of these different levels. And we break these modules down into one module that's more focused on organizational approaches. And by that, we mean the organization is putting forth the effort, or is the real, the focal entity that's acting in that example. And so an organizational approach might be something like redesigning work, or redesigning a workspace, or changing a policy or a procedure that affects workers. And so we spend some time giving examples of what the organization might do to affect burnout at all of these different levels. And then we get into employee-focused approaches as well. And we kind of intentionally put the organizational approaches first, because lots of what we talk about and lots of what we see in intervention work sometimes goes to the employee first. But if we always focus on the employee being the one to fix the problem, that underlying problem might still be there. We can give someone stress management, but if the main problem they're facing is work overload or too many demands, then that's not necessarily going to help fix that imbalanced problem. And so we always want to make sure we do think through, well, what is the organization's responsibility? And then what also could the individual do? And this might include things like stress management techniques, better recovery outside of work. I know a theme that came up a lot in our interviews were sometimes that public health workers are pretty good at working on things like physical fitness, but may not take care of their mental health as well sometimes. So we talk about what good recovery looks like and how to make sure you take time to detach and separate from your work, and things that employees can do to reduce their burnout risk. And then in our last module, this is where we provide some really tangible resources to help you identify what is an area of need that I could address to help with burnout? And then what are some steps I could take to get there? This is an example of the planning guide that we provided. We have a blank one for you to fill in and recognize places where you could intervene or provide some support. We also have one that we filled in with just some examples, because sometimes it can take a lot to really think through all these different levels and what that looks like. So you have a completed example and then a blank one, and you're really going through and thinking about, for individual workers or work groups or for leaders in my organization, what are some of those demands that may be contributing to burnout? What are some of the resources that could help? Is there a gap between those demands that they're facing and the resources that they need? And then what would be something we can do to address that gap? Could we reduce a demand, make it less frequent or less impactful? Could we increase a resource, or maybe some combination? And so this just offers a way to think more about your current work situation and what resources could help. And this could even be completed either by a leader or as a work group to try to brainstorm together. But this is more of an assessment to figure out what are gaps that we have and things we can do to contribute. We then also add just a set of questions to really help you to implement a change. So this is framed in, take that assessment you just did and pick one thing that you could practically do. What's a practical step that you could take? And we want you to be able to articulate, what is it that you're trying to change? Are you trying to reduce a demand? Are you trying to increase a resource? Are you trying to change maybe a reaction to a demand, or change people's appraisal of a demand, whether that's something like changing how they view maybe a task that feels a little bit draining or mind numbing, whatever that is, seeing greater purpose. So what is it that you're trying to change? Who is involved in this? So sometimes maybe you're just training leaders, or maybe it's all workers that need training, or maybe you're even incorporating community members. So who should be involved? Why are you making this change? Regardless of what you're doing, you're going to have stakeholders that are going to want to know why. Sometimes that's just the employees participating. They want to know, why are you using my time on this when I have so many other things that I could do? So what's your why? And sometimes that might also mean advocating to higher level leaders to get resources that you need. Maybe that's tangible resources or time, whatever that is. We have to be able to articulate why it matters. We want to be able to say how it's going to work. So how is this change going to actually impact burnout? And so we have a lot of interventions that we might implement that can be fine, that really are beneficial to workers in some way. But for instance, if I bring in someone to do guided meditation for one lunch break, how can I articulate how that's going to long-term impact burnout? And that makes us really think through, is this a change that's going to have an impact? And sometimes the answer is the impact might be small, but other changes we can make may have a bigger impact, and we can say how it's going to work. And then we add the question of where is that change taking place? Does it fit within their typical work day or typical work arrangements? Is it even something that can benefit them outside of work? And when we think about total worker health, that we have opportunities sometimes to train skills or make changes that can benefit the worker both in their workplace and outside of their work environment. So those are some of the examples of questions that we want you to ask as you think about what change looks like and how you can make that change in your workplace. I know that was a lot of information, started pretty quickly through that, but we wanted to give a preview of what you could expect, and then allow also time for you all to just ask questions. I think Emily's going to facilitate that now, and we'll be available to answer any questions that you have.
Yeah, thank you so much for that overview. And so please go ahead and use the Q&A box to submit your questions. So let's start out with this one. How long does it take for employees to recover from burnout?
That's a great question, and I'll certainly take a start on this, and Kristen, feel free to dive in and add anything else you'd like. But it's a tricky question to answer, because right now, the way that we measure and assess burnout is not sensitive enough to really place people into different levels of burnout. So for instance, we don't have like your light burnout, your medium burnout, your full burnout. Like we just have this one bucket called burnout. And as Kristen and I were saying, a lot of times that label is really misapplied. What a much better label might be is that this person's feeling very fatigued. This person's feeling like they've lost their sense of purpose and meaning. This person's feeling a little bit cynical, but they don't have all of the symptoms associated with burnout. Why this is so important is if we can get better at identifying the actual strains and nature strains that people are feeling, we can design interventions that target those strains specifically. So if I am feeling fatigue, then I need to focus on addressing that fatigue. And it might mean getting physical rest, but it could be an emotional type of fatigue where I just really need to separate myself for a while from a really difficult, maybe traumatic situation. Dealing with that kind of fatigue, emotional fatigue, is often harder than dealing with physical fatigue. Similarly, if I've lost my sense of meaning, I might be able to address that pretty quickly by having a really focused conversation with my supervisor, and they can help me see the value that I bring to my role. Or maybe I need to have an opportunity to learn the impact I'm having on my clients, or I need my coworkers to stand up and pat me on the back and say, hey, you did a really great job with that difficult situation. So some facets of burnout are fairly easy and quick to address, and other facets are not. And so although the question itself is very simple, we don't really have enough sensitivity in the way we approach the measurement and discussion of burnout to be able to say to you, yeah, all burnout cases can be resolved in 30 days or less. I'm not prepared to say something like that because it really does vary person to person. Kristen, what would you add there?
Yeah, I think that's a good summary too, that it's hard to say how long. And I think probably the more the message that we give to you in the training is that it doesn't go away without some effort. And so we don't know exactly how long it takes when you're trying to get rid of burnout or become not burned out, but we know that it doesn't just go away like a cold when it's run its course. And so that's one of the big things we talk about, is that doing nothing is probably not going to help. And then we talk too about the symptoms of burnout can really be kind of self-undermining, that there can be effects of burnout that make it worse over time. Maybe you're burned out and fatigued, and then you mess up a big project, make a big mistake, and then that undermines your self-esteem, so it can get cyclical. So that's kind of the addition I have, is just it doesn't get better without some effort typically.
Thank you. So this next question kind of picks up on what you were saying about measurement, Chris. So can you talk about how we measure change and impact from the interventions we implement?
Well, yeah, we could teach a whole course on that if we had the time. So this is a really big question, and it's a big challenge that addresses anyone trying to do intervention work, because a lot of times the idea for the intervention is developed, but there's not a corresponding idea for how are we going to prove that this works. So like we're like, hey, we should try this, without a lot of thought on, well, why? Like, what is this actually supposed to impact? So to answer that question, we have to get a little more concrete over what specifically are we doing intervention-wise. So for instance, if we are trying to roll out some sort of improvement in self-awareness of recovery needs, how to know when I'm experiencing physical versus emotional fatigue, how to know when I'm maybe developing a little cynicism and I need to address that. If that's our target, then our evaluation strategy has to be developed in a way that it works at that person level and allows them to reflect on where they are now versus where they are after a period of intervention, and so on. Similarly, if we're doing an intervention that's maybe at a higher level, where we're trying to increase usage of an organization's flexible work scheduling options, or if we're trying to increase people's usage of PTO or vacation time, well, one way we could evaluate that doesn't involve surveying people at all. We can just start tracking the actual utilization of those, the metrics associated with that benefit. So I think Kristen and I have actually spoken a lot about this, because it was one of the challenges we ran into when we were writing that Essentials of OHP textbook, is when we're evaluating interventions, you really have to decide, like, what were you hoping to move the needle on? And then you develop a measurement strategy that's focused on that particular target. Would you add anything else there, Kristen?
No, I think that was a good summary. And we do have some links in the training to some example measures if you want to survey your employees NIOSH put together a really solid survey of different measures of employee well-being and things like that called the Well-BQ. And so we reference that and some other measures if you're looking for what do I put in a survey or what do I measure? But I think it comes back to what you're trying to change first.
So I'll actually take this next one. Is the training available in Spanish? Currently no, but that's a great suggestion. Thank you. Okay, so if you only have the time and energy for one strategy to reduce burnout in your team, what would you recommend?
You want to go first, Kristen?
That's a great question. So I think Chris and I are both a little bit biased and leaning toward talking about social support as kind of one of the most powerful resources that we have, and social support can fill a lot of different needs. So if it was one strategy, I would think about what does it look like to enhance social support in your team? And maybe that's just having more intentional weekly meetings where we talk about like, what's your demand that's a little too much this week? How could we help each other out? Or even having someone to listen, because your teammates understand your work demands the best of anybody, even more so than if you go home and talk to your spouse about something. They might not understand the tedious paperwork you're doing. And so the people on your team are going to be best situated to help you. And they can be the ones too to encourage you to take a break or go for a walk together, maybe a walking meeting instead of trying to cram in another few minutes on a Zoom screen or something like that. And so I think that would be my answer, is trying to figure out how to boost appropriate work social support. So sorry if I stole your answer too, Chris, but you got that one to add.
Hey, it happens when you work together, right? So I would totally second that. And I would just add to, if you're having a hard time understanding why Kristen and I both believe social support's that important, you might want to consider looking at the 2022 U.S. Surgeon General's framework for improving worker well-being. And in it, there's 10 factors that are identified as essential for this. And every single one of those factors is improved when there is healthy social support present in the workplace. So that's another way of looking at why it's it's one of those focal points that has a multiplier effect on a lot of other factors that we want to see as positive forces.
Okay, great. Thank you. Do you recommend taking the training individually or in scheduled group times? So allowing for shared discussion, or maybe both.
Great question, really. And I want to hear Kristen's perspective on this. This is not something we've talked about at length, but from my perspective, I would certainly encourage people to do the training individually, but then plan to discuss as a group, because the reason for that is one thing that we've found in our work, not just in developing this training, but in other work that we've done with different groups, is that not everybody experiences burnout the same way for the same reasons and to the same extent. And so trying to work through this as one group at one time may leave some people feeling like, okay, I didn't really get a chance to process that for myself, or, okay, I hear what you're saying, and I guess maybe that's the way I should think of it too. Usually for this type of training, we would want individuals to sort of internalize and process this and then have a chance to discuss it. And that's why, as Kristen mentioned, we've tried to bake in discussion prompts and points that you could discuss as a leader, supervisor with your teams as a follow-on opportunity.
Absolutely. If you have the opportunity to maybe work with other leaders and be able to discuss this, then that could be a great opportunity to have some accountability and some shared ideas. One thing we do talk about, if you were, say, taking this training and including your workers with that, we do talk about the importance too of when you do have scheduled group time to make sure you kind of take control managing it, because there is the temptation if you start saying, well, what are the demands of your work that are too much? It could just turn into a rant session that ultimately leaves people more frustrated than when they started. And so I think that's our one kind of warning, is that when you get into group discussion, if that is either with other leaders or with people that you supervise, to try to be intentional about how that time is structured and not let it turn into a instance where we're just talking about everything that's wrong and not working on strategies, because we can all probably get some rant sessions that could take up an entire scheduled time as well.
Okay, so building on this, there's another question about supervisors engaging employees on these kind of burnout prevention discussions and strategies. So employee engagement seems important to ensure the strategies are actually helpful, but if the employees, they might already have too many demands, and then this could feel like just another burden. So how would you balance that?
One thing that's really important, and I'm sure that the majority of people on this webinar already appreciate this, but I just want to make sure everybody walks away with this appreciation, is that for a while, burnout and engagement were seen as opposing ends of the same continuum. So if you were burned out, you were not engaged, and vice versa. Subsequent research proved that that really wasn't the best way of looking at it. In fact, sometimes, and this was mentioned in the presentation, sometimes those who are very engaged are at the highest risk of burnout because they're putting literally everything they have on the line to do their work. So it's never going to be enough to combat burnout by facilitating engagement. Engagement, put simply, is it's a choice that employees make to really put their best selves into the work that they're doing. And it's a choice that is facilitated by the way we design work, the way that we supervise, the way that we provide supports and all other types of resources they need. But it's a choice that's hindered when people are experiencing burnout or other serious strained states. So on the one hand, if you're able to address and reduce burnout, you are contributing to healthy conditions for engagement. But you can't mask or cover over burnout by just saying, you know what, while you're at work, just at least pretend to be engaged and you'll feel better. That's not going to be enough for people, because it's burnout is a real weight, in a way that's kind of preventing them from being able to put their best selves into the job. Those are just some initial thoughts that I would share here. Kristen, what else?
I think that goes back to what we talk about in that planning guide that we provide. We really push you to understand your why. And I think that when you can make a good why case, even to your employees on why this is important, why we're taking time to address these demands, and even talking about the long-term impact, because yeah, it'll take some time now, but how could it benefit you in the future, or help you to do your work better, or to be happier, more energized when you go home. I think being able to walk through those why statements can help you to get that buy-in from workers who are already overloaded sometimes. And maybe sometimes if you have the resources to bring in someone external to help or something like that, that might be another strategy to try to relieve some of that demand.
Okay, so I think this next one touches on that, making your case for why. So does the course have insight into how to get senior leaders like vice presidents or C-suite leaders on board with addressing workplace burnout from an organizational level?
I would say in some of those first modules, we try to include a lot of that information on how to make the case on how burnout relates to turnover, how it might affect productivity. And I gave that example earlier of kind of self-undermining. Workers that are burned out sometimes make more mistakes and then they get more burned out. And so we try to make some of those cases and give some examples of some of those factors that can be affected if you don't put in investment. And we try to also be realistic in providing some examples of strategies that are really inexpensive too. So like social support is essentially free, right? So you can increase social support. We're not necessarily advocating for weekend-long retreats at a spa or something like that as a solution to this. So we've tried to make sure these are things that are relatively, there's some options that are relatively simple. Some would take a lot more work and would require more investment, but hopefully there's a lot of strategies to choose from that can be really easy to advocate for if they aren't taking a whole lot of resources, but could make a big difference in some of those outcomes organizations care about, like turnover and productivity and some of those things.
Okay, thank you. So the next couple of questions are about self-care. So one person says, thank you for the acknowledgement that self-care is insufficient to solve the systemic issues that contribute to burnout. Do you have any examples of organizational level policy changes that institutions have made?
That are not self-care related. I'm
Yes.
assuming they'll be okay. Yeah. So,
Yeah.
and I know you can't read the mind of the person asking the question. I'm just verbalizing for myself how I'm trying to process it. I think, well, yeah, I mean, we've baked several examples of that throughout, to try to give a couple of additional examples, maybe. So one challenge that a lot of folks face in environments like public health is that the demands almost chronically exceed the resources to meet those demands. And so there's probably never going to be a day where people show up to work and are like, I've got more resources than I've got demands. I don't know what to do. It's never going to be that way. There's always going to be more work. So one of the things that organizations have control over that can help make resources stretch a little further is working with their employees and empowering them to engage in a little bit of crafting around their work. And so how do I approach this? What order do I approach it in? To what extent do I take this work to a certain quality endpoint? So that would be an example of an organizationally controlled sort of policy, procedure, process element. Another one that's related, it has to do with the degree to which there's autonomy and flexibility around where the work's being done, sometimes when the work's being done. And we all know that there are certain jobs where that kind of flexibility and autonomy just is not an option. Like there has to be this role filled, and that's fine. But consider engaging and involving employees in the setting of those schedules. One thing that's astounded me in some of the work that we've done over the years is just how many work groups don't factor in any input from their team members when schedules are set. And then they're surprised when people are upset about what they're being asked to do and when they're being asked to do it. And so this doesn't mean that you're going to have no coverage. It just means that you're going to have people getting a chance to feel like they've got a little bit of say in that. But those are two like really quick examples of things that can be done at an organizational level.
I think there was one kind of intervention we came across when we were looking into background and what people are doing. This was more of a hospital system, but I love that they had a program called Getting Rid of Stupid Stuff. And it was essentially this program where they let people nominate, this is stupid stuff. Maybe it was outdated forms or a process they went through, but they allowed people some space to nominate a task that they thought was pointless or not helpful. And then some of them they legitimately just got rid of because they realized we don't know why we do this. But that involved people. And then the tasks too that were nominated, that there is a reason to do it, then there's a way to like justify, we're not doing this just to torture you, we're doing this because it's important in this way. And so that was one way that maybe it's just because of the name, but I think the concept is good too, and involving workers for the organization to just take a good look at maybe some unnecessary demands that they're placing on workers. So that was one example that came to mind.
So another one touching on kind of self-care and resilience. Does the training cover strengthening resilience so that the person doesn't get to burnout, or does it talk about like early warning signs that you could mitigate along the way before they get to kind of deep burnout?
Yeah, I think we can, lots of times resilience has, I feel like it's getting kind of a more negative connotation. Sometimes it will just be more resilient and you won't get burned out. And I think we think about it a little differently than that to us, resilience just kind of boils down to having a lot of resources. And so that is something that we definitely address in the training. It's just how to boost resources available to workers, including their personal resources and social resources in the workplace. So I think that's one thing we do focus on, is just boosting resources if we look at it that way. Kristen might have more ideas too on resilience a little bit more.
I think that's a good kind of high level response to this question, because it's a really good question, and we certainly don't want to discount that there is importance around this idea of needing to take care of ourselves. Like that is important. It's just not enough by itself. And the other thing that's important is to recognize that resilience is not solely a function of who we are, like personality wise or cognitively. It's also a function of the context in which we work. And we know this from research we've been doing over the past 10, 15, 20 years. One study that I know I just finished really clearly pointed out that with healthcare professionals in particular, their resilience in large part was attributed to the people that they worked with. Their social work groups made it possible for them to bounce back. It wasn't, they weren't asserting that it was like who I am and the way I see the world. It was more of who am I surrounded by and who do I know I can lean on when I have complexity. So this goes back to an earlier point you raised too about like if you could change one thing, right? It's to increase that positive social support, because that makes it possible for other resources like flexibility, clarity, trust, all this stuff to kind of flow where they need to flow at that particular time.
Okay. The next couple of questions are about kind of things that are unique to the public health workforce. So this one is about how the public health workforce is largely female. And so to what extent did you apply a gender lens, or did this come up when you did your interviews and your background research? Anything about that?
That's a good question. And I think that some aspects of that came up maybe in our interviews, where we found a lot of women workers that we interviewed were very likely to kind of sacrifice in some ways and to go above and beyond. And that was kind of a norm, especially those that feel kind of a calling and a deep sense of care. Sometimes you can be more likely to get in that state of burnout because you just keep wanting to do more and more and more. I don't know that we necessarily took into or framed anything differently for female-dominated versus male-dominated workforce, because we feel pretty strongly that lots of times it's just about evaluating your demands and your resources. And there may be some demands or resources that are more accessible or more helpful for some of those more kind of caring occupations or those female-dominated work groups. But ultimately, I think it's really just about identifying the demands and resources important to that group, and just working from there on how to find the right correspondence and the right balance.
Yeah, I agree with that. And when we took on this project, Kristen and I were just rolling off of another project on burnout in women specifically. It was a very large scale project. And we certainly had that on our minds as we were building the content for this course. So there are elements that have worked their way in here. But one of the things that's kind of challenging in this particular setting is that although it may be the case that large portions of the workforce are female, the demands don't always come from a female originating source, and the resources needed to address those demands are also not always gender specific. And so we also didn't want to limit people's ability to respond, especially in situations that are constantly or at least frequently changing and involving interacting with a lot of different types of stakeholders. So I can't say to you that, you walk into this training and say, well, that'll work well for women, but not for men. I don't think you'll feel that way. I don't think there's going to be parts of the training where you get into and be like, well, that'll only work for men. That's clearly not for women. Like we tried to be very conscious of that. But as Kristen said, there's a lot of universality to some of the key features here that we're trying to emphasize so that they can be broadly applied.
Okay. Thank you. Another question is about what's unique about public health that makes burnout so prevalent?
I think we heard over and over again in interviews this idea of do more with less. I think we heard that phrase several times, that lots of the work that's done is often just high demand type work, and there are resource constraints. So I think that's really the driver of why we see this in public health, is just the working sometimes with limited resources and having to be creative with solutions. I think that was really one of the driving factors we saw.
Yeah. And Chris and I both do a lot of work in healthcare space. And one of the other differentiators that stood out to me as we were focusing on this public health population is that the overarching context has not been very kind to this population. So societally, and especially in certain areas of our country and world, a public health professional is not really viewed with the same respect and enthusiasm as many other highly trained professionals. And so there's a lack of this understanding that, well, even if my day-to-day work is challenging, the society's got my back. That's not really the norm for a lot of folks that are working so hard in public health, because often they're responding to a health emergency or a critical issue that people are not feeling so good about, and they're angry that it now has to be a response and it wasn't prevented in the first place. And this was probably echoed pretty heavily when we were talking to folks, because we were still rolling out of that COVID peak period. So it's understandable. But we've also been interacting with public health professionals for most of our career. And this has often been the case, that they're just not feeling well supported in a general sense. And so they're being asked to do something for the public good without necessarily having the public support. That's a really tricky situation to be in. And we do fully appreciate that, and have tried to speak to that as consistently as we can throughout the training.
Thank you. So a couple of people would like to know whether this training is applicable or helpful to people outside of public health.
I would say yes, as long as you're okay with examples that lean toward public health contexts. We both, Kristen and I, do a lot of work with professionals in all kinds of disciplines, everything from the legal profession to medicine to first responders, police, fire, EMTs, educators. A lot of the core principles here we've been able to apply with good effect in these different populations. So there's definitely generalizability there. That said, given the orientation of the training, we did try our best to keep it focused as much as possible on that population. So would you find nuggets that you could use elsewhere? For sure. And if you work in a domain that is at least tangentially related to public health, it'd be very easy for you to see the tie-ins.
I'll add, as a person who sees the registrations coming in, that I have seen registrations from other types of organizations, particularly healthcare, seem to find value in this. And I think Unit 2, where it talks about demands and resources, those are kind of fundamental principles, even though the examples are public health, that kind of concept and helping you think about the different ways burnout, the different demands on your time and the different resources, that's a concept for any workplace. This question is a little bit more about course design. So how did you decide on the length of the course?
I think it was how much would they let us do without overwhelming them. So we get into these topics, it's easy to just have a lot to say, but ultimately we wanted to make these modules something that you could set down maybe at a lunch break, or if you have just a half hour to get one module done. We wanted to make them as simple and straightforward as possible, while also trying to cover both enough background knowledge to understand what burnout is and kind of that demands and resources perspective and what you can do about it. So I think ultimately it came down to the timing that we needed to be enough, but enough to get the main content out, but not so much that it's overwhelming and doesn't seem feasible to complete and within your normal schedule.
Yeah, and I would add that there were no debates about, can you guys just make this longer? That was never one of the questions. It was, can you guys just make this shorter? And the answer was to a point. But like Kristen said, like we're not comfortable having our names on something that ends up being too thin or watered down. We don't believe that creates value. And so again, I just want to highlight this great partnership with our colleagues at NIOSH, being willing to say, all right, if we need to keep it there, then we need to keep it there, and then figuring out how to make that work.
So another one is, what is the difference between burnout and depression?
And so this was alluded to a little bit earlier, right? That there are a lot of not only strain states, but also psychological or mental health conditions that might have similar symptoms or effects on a person's work ability to burnout. Now we got to say very clearly, Kristen and I are not licensed mental health professionals. Okay, so we're trained as industrial organizational occupational health psychologists. So we can only offer that perspective, okay? But one major difference is that depression and anxiety and other mental health conditions, many times they can be generalized, or they can be triggered or caused or induced by a lot of different factors. And one that creates one major point of differentiation with burnout, because burnout is generally seen, as was shown in the definition earlier, as a work-related phenomenon or a work-related syndrome, meaning it's connected to the efforts that you're expending in a work context, and it's connected to the extent to which those work efforts are leading to outcomes that are meaningful and important to you versus not. If we are consistently working our heart out at our jobs and we're not having the desired effect, or the effect's not meaningful, or we don't feel like we're actually able to do that work, that over time is what leads to us experiencing burnout. And that's very specific compared to what can contribute to depression or anxiety or other conditions like that.
I think that's a good summary. And I think it is also worth noting too that we've talked before about making the case for why this is important. And sometimes something like burnout can be correlated with depression. So we do also want to acknowledge burnout for the connection it can have to other mental health states as well, though we view them as distinct. They can be related if you get to a state of prolonged burnout and maybe some other life factors going on.
Okay, so we're almost out of time, so this is a nice wrap-up question. So a couple of folks are asking for additional resources. So obviously, we'd love you to check out our training um, on the NIOSH website. And you already mentioned your textbook and the Surgeon General's report. Are there any other things that you would encourage people to read or look into if they're interested in this topic?
Well, as Kristen mentioned, in every module, we have taken time to identify our favorite additional resources that are related to each topic. And so, and that list is, I mean, honestly, I think it's a pretty good list because, again, we've been doing this work for a couple of decades now. In that list, you'll see some of the stuff we've already mentioned. But one other really great website that has a wealth of resources is the supportiveleadership.org website, which is a summary of a lot of the work that Dr. Leslie Hammer has done in a variety of different contexts. And so there's broad applicability there. There are a number of other tools like the NIOSH WellBQ that was mentioned earlier that can be really helpful if you're trying to do some measurement and basic survey work. Harvard School of Public Health has a similar instrument that also covers a lot of different dimensions of worker health and well-being. And so the resources like that are more readily available now than they've ever been. And those would be good things to highlight.
Fantastic. Well, thank you both so much for taking time out of your day to come share with us about the course and all of your other deep knowledge about burnout. I'd like at this point to invite you to connect with us. And we invite you to stay connected with us through our website and social media and to sign up for the Total Worker Health in Action newsletter to stay up to date on the latest news from our program and partners. Thank you so much for joining us this afternoon, and I hope everyone has a great day.